Mental health disorders are real medical conditions. They affect how a person thinks, feels, and behaves. These disorders can range from mild to severe. They can interfere with a person's ability to work, study, or maintain relationships. Examples include depression, anxiety disorders, and bipolar disorder. It's important to remember that mental health is just as important as physical health. Everyone experiences emotional ups and downs. However, when these feelings become overwhelming or interfere with daily life, it may indicate a mental health disorder. Recognizing the signs of a mental health disorder early is crucial. Early recognition can make a significant difference in the trajectory of a person's mental health journey. It allows for timely intervention, which can prevent the condition from worsening and can lead to more effective treatment outcomes. Mental health disorders often start with subtle signs that can be easily overlooked or dismissed. These signs can include changes in mood, behavior, or thinking patterns. For instance, a person might start to withdraw from social activities they once enjoyed, or they might experience persistent feelings of sadness or anxiety. Recognizing these early signs is the first step towards getting the help that is needed. Early intervention can lead to better treatment outcomes. When mental health issues are identified and addressed early, individuals have a better chance of managing their symptoms and improving their quality of life. This can involve a range of treatments, including therapy, medication, and lifestyle changes. Mental health professionals can work with individuals to develop a personalized treatment plan that addresses their specific needs. This collaborative approach can empower individuals to take control of their mental health and make positive changes in their lives. When mental health disorders are left untreated, they can worsen over time. This can lead to more severe symptoms and a greater impact on a person's life. Untreated mental health issues can affect every aspect of a person's life, including their relationships, work, and physical health. For example, untreated depression can lead to difficulties in maintaining relationships and performing daily tasks. It can also increase the risk of developing other health problems, such as heart disease or diabetes. Therefore, it is essential to address mental health concerns as soon as they arise. This can lead to more severe symptoms and a greater impact on a person's life. The longer a mental health disorder goes untreated, the more challenging it can become to manage. This can result in a cycle of worsening symptoms and increasing difficulties in daily life. For instance, anxiety disorders can lead to avoidance behaviors, which can limit a person's ability to function in social or work settings. By recognizing and addressing these issues early, individuals can break this cycle and work towards recovery. Early detection and treatment can help individuals manage their symptoms effectively. With the right support and treatment, individuals can learn to cope with their symptoms and lead fulfilling lives. This might involve a combination of therapy, medication, and self-care strategies. Mental health professionals can provide guidance and support throughout this process, helping individuals to develop the skills and resilience needed to manage their mental health. It can also prevent complications and improve their overall quality of life. Early treatment can reduce the risk of developing additional mental health issues and can help individuals to maintain their overall well-being. Engaging in healthy activities such as exercise and hobbies can also play a crucial role in supporting mental health. By taking proactive steps to address mental health concerns, individuals can improve their quality of life and achieve their full potential. If you notice any changes in yourself or someone you care about, don't hesitate to reach out for help. Seeking help is a sign of strength, not weakness. There are many resources available, including mental health professionals, support groups, and hotlines. Talking to a trusted friend or family member can also be a valuable first step. Remember, early recognition and intervention can make a significant difference in managing mental health and improving overall well-being. Don't wait to get the help you need. Emotional changes are often the first noticeable signs of a mental health disorder. Pay attention to persistent feelings of sadness, hopelessness, or worthlessness. These can be indicators of depression. Extreme mood swings, such as periods of intense happiness followed by extreme sadness, are another warning sign. These shifts in mood can be a sign of bipolar disorder. If you or someone you know is experiencing dramatic emotional changes, it's essential to seek professional guidance. Mental health disorders can also affect cognitive function. You might notice difficulty concentrating, remembering things, or making decisions. These cognitive changes can be subtle at first, but can become more pronounced over time. Confusion and disorientation are also red flags. These symptoms can be associated with more severe mental health conditions. If you're struggling to think clearly or feel like you're in a fog, it's important to talk to a healthcare professional. Behavioral red flags can be a crucial indicator of mental health disorders. These signs often manifest subtly at first, but over time, they can become more pronounced and harder to ignore. It's important to pay attention to these changes, as they can provide valuable insights into a person's mental state. Changes in behavior, well, they can signal that something isn't quite right. For example, someone who was once very engaged and active might start to withdraw and lose interest in activities they used to enjoy. This shift can be gradual, making it easy to overlook at first. For instance, social withdrawal, avoiding social events or isolating oneself from loved ones, is a common sign. This can be particularly concerning if the person was previously very social and outgoing. They might start to make excuses to avoid gatherings or leave events early, preferring to be alone. Increased substance use, whether it's alcohol or drugs, might be a way of self-medicating to cope with difficult emotions. This behavior can escalate quickly, leading to dependency and further complicating the individual's mental health. It's a dangerous cycle that can be hard to break without professional help. And yes, changes in sleep patterns like insomnia or excessive sleeping are also common behavioral changes. Sleep disturbances can have a significant impact on a person's overall well-being, affecting their mood, energy levels, and ability to function during the day. It's a clear sign that something might be amiss. If you notice significant changes in your own behavior or someone else's, don't ignore them. These changes are often a cry for help, even if the person isn't able to articulate what they're going through. It's crucial to approach the situation with empathy and understanding. It could be a sign that help is needed. Reaching out to a mental health professional can make a world of difference. Early intervention can prevent the situation from worsening and provide the support needed to navigate through tough times. Remember, it's okay to seek help and it's okay to offer help to those who might need it. Section 6. Physical manifestations, the body's response. Our bodies often communicate what our minds are experiencing, even when we aren't fully aware of it ourselves. Mental health disorders can also manifest physically. This means that the emotional and psychological stress we endure can translate into physical symptoms. For instance, when someone is under a lot of stress or dealing with anxiety, they might experience frequent headaches or migraines. These headaches are not just random, they are a direct response to the mental strain the person is under. Unexplained aches and pains, such as headaches, stomach aches, or muscle tension, can be signs of underlying mental health issues. It's not uncommon for people to visit multiple doctors, seeking answers for these persistent pains, only to find no clear medical cause. This can be incredibly frustrating and can sometimes lead to feelings of hopelessness. However, recognizing that these physical symptoms might be linked to mental health can be the first step towards finding relief. Changes in appetite or eating habits, such as loss of appetite or overeating, are also common. When someone is feeling depressed or anxious, their relationship with food can change dramatically. Some people might find that they lose interest in eating altogether, while others might turn to food for comfort, leading to overeating. These changes can further impact one's physical health, leading to weight loss or gain, and can create a cycle that's hard to break. Fatigue and low energy levels are frequently reported by individuals struggling with mental health disorders. This isn't just about feeling a little tired, it's a deep, pervasive exhaustion that makes even the simplest tasks feel overwhelming. People might find it hard to get out of bed in the morning, or they might feel the need to take frequent naps throughout the day. This kind of fatigue can significantly impact one's quality of life and ability to function daily. If you're experiencing persistent physical symptoms without a clear medical explanation, it's crucial to consider the possibility of a mental health component. Many people are unaware of how closely linked our mental and physical health are. By acknowledging this connection, we can better address the root causes of our symptoms and seek appropriate treatment. Consulting with a healthcare provider who understands the interplay between mental and physical health can be incredibly beneficial in these situations. Section 7. Additional signs beyond the obvious. Other signs of mental health disorders can include unusual beliefs or paranoia, extreme anxiety or fear, and difficulty coping with stress. Suicidal thoughts or thoughts of self-harm are serious warning signs that require immediate attention. Remember that every individual is different, and symptoms can vary widely. If you're concerned about your mental health or the mental health of someone you know, don't hesitate to seek professional help. Section 8. Seeking professional help. The first step to recovery. If you recognize any of the signs and symptoms mentioned above, it's essential to seek professional help. A healthcare professional can conduct a thorough evaluation, provide an accurate diagnosis, and recommend the most appropriate treatment plan. Treatment for mental health disorders typically involves a combination of psychotherapy and medication. Psychotherapy, also known as talk therapy, helps individuals understand and manage their thoughts, feelings, and behaviors. Section 9. Conclusion: taking action for mental wellness. Mental health disorders are common, but they are treatable. Early identification and intervention are crucial for improving outcomes and enhancing overall well-being. Remember that seeking help is a sign of strength, not weakness. By understanding the signs and symptoms of mental health disorders, we can create a more supportive and understanding environment for ourselves and those around us. Together, we can break down the stigma surrounding mental health and encourage individuals to seek the help they deserve.